So this is likely why we see these lower leg compensations. We get a little bit too much activation in this outer part of the leg. All right, so in this video, we're going to talk all about peroneal tendonitis. Really, there's two reasons I'm making this video. The first is that the patterning and positioning that we'll describe here in a second is really common amongst those who I see with complaints of peroneal tendonitis. Now, the second reason is that not only do I share the positioning and patterning, but I'm also experiencing symptoms of peroneal tendonitis as we speak. So this topic is especially salient for me right now, and I came up with a couple of exercises that we'll talk about later that I've used to get better in just a few days. And if you have this same presentation that we're going to describe here in a second, I think you'll find that they're pretty effective. So let's start off by talking about the patterning and positioning first and explain what peroneal tendonitis is, and then later we'll get into the exercises. So when we think about peroneal tendonitis, this is really an overuse of the peroneal tendons. So your peroneal muscles all attach onto this bone here, the fibula, and then they go down and they attach onto this lateral aspect of the foot. And so the peroneus longus, which is your main peroneal muscle, is going to attach way up on this bone closer to the knee. Then it's going to come down and it's going to attach onto this base of the fifth metatarsal and then come around and attach to this base of the first metatarsal. And when I'm describing this, I'm really going to be talking about this in terms of the peroneus longus muscle. There are other peroneal muscles too, which are also probably involved to some extent, but the representation in my mind that I've used to address this successfully is using this peroneus longus muscle as a representation of what we're trying to achieve. So the peroneus longus muscle, when it's in a shortened position, can do a couple of different actions. So it can point the foot into plantar flexion, it can evert the foot out to the side like this, and then because it attaches to this base of the first metatarsal, it can also depress this first metatarsal down when we're walking. Now these are all important functions, but if we have a foot that's oriented out to the side and caved in, already in an everted position, then this peroneus longus muscle is already going to be in a shortened position to start. So when we're loading through that foot and that peroneus longus muscle doesn't have help from some of the other muscles on that inside part of the lower leg, it might be being asked to do a little bit too much. Now in a second here, we're going to talk through the entire chain all the way from the hip down and why this is probably occurring in the first place. And then we're going to go through what to do about it. If you're enjoying this video so far, consider liking it, leaving any questions you have down below in the comments, or if you haven't already, subscribe to the channel. All these things help the algorithm to help me help more people. Now, I think one of the reasons that people have difficulty successfully treating this condition is because they're only looking at this imbalance that I've talked about in the lower leg, but they don't understand why this is happening in the first place. So we're going to talk through the chain of events that's happening all the way from the pelvis down to the foot and explain the likely reason that this is happening in the first place. Then we're going to talk through a little bit more of a comprehensive approach that takes into account the position and strategy at the hip and the knee as well. So let's go ahead and get my buddy Mr. Phibbs, who is literally born for this video because of his misshapen fibula, and he's going to help us to see this presentation that I'm talking about. Okay, so there's literally no one better than Mr. Phibbs for this video because I've named him because his fibula are kind of misshapen. So very good and expensive anatomical model, but terrible fibula. So he gets the name of Mr. Phibbs. But it's an endearing name. Anyways, so the peroneus longus that we were talking about, it attached all the way up here, and then it runs all the way down, comes under that foot, wraps all the way around to the base of the first metatarsal. So like we said, it's going to point the foot, can also evert it out to the side, and it's going to be especially in a shortened position when we have a turned out position here at the lower leg and that caved in everted position at the foot. So if you watch my video on flat feet, if you have a foot that kind of looks like that, then you're probably in this camp. Now, we want to ask ourselves, what is actually causing this in the first place? So if we think about what that flat foot is, the flat foot is really a strategy to get the inner part of the foot on the ground to drive force down into the ground into internal rotation. So talked about in a couple of other videos that internal rotation is a strategy of pushing force down into the ground, and it's going to be represented throughout the various joints of the lower leg. Now, typically, we want to be able to drive that strategy from the pelvis down, and then every joint as we go down here will have alternating motions that allow us to push that into the ground while keeping alignment. When we don't have that motion here, we then can compensate at the knee and the ankle. And in this case of peroneal tendonitis, I see compensations both at the knee and the ankle as well. So what we're going to see here is we have a lack of internal rotation here. So we're typically going to bring the knee inwards into adduction, so closer to the midline. And we're going to get this distal femur that's coming into a little bit too much adduction internal rotation. Now, relative to that, we're going to have an externally rotated proximal tibia here. And then as we go down to the foot, what we're going to see is the foot follows this tibia, but then everts like this, so that the whole foot's everting as a unit, so we can get this inner part of the foot down to the ground. And as you can see, if we were to attach that peroneus longus from here to here, and we go into that position, we're going to be in a very shortened state to start with. Now what this is also going to do is it's going to lengthen the muscles on the inner aspect of the heel and the inner aspect of the lower leg. So when we're landing from a jump or when we're running, and we need to go from a pointed position in the foot to more of a dorsiflex position in the foot, we're going to have a lot of lengthening here, and these muscles are going to be very disadvantaged, versus the muscles here are going to be working a little bit too hard. So this is likely why we see these lower leg compensations. We get a little bit too much activation in this outer part of the leg. So remember, just to review, we have a loss of internal rotation at the hip. We have a compensation into adduction internal rotation at the knee here at the distal femur. We then have relative external rotation here at the proximal tibia. We have a foot that follows and then caves in, which produces a concentric position of that peroneal muscle and an eccentric position here in that medial aspect of the lower leg. So what we need to do is we need to get a more concentric or shortened position here in this medial aspect of the lower leg. We need a foot that goes more towards inversion. We need a tibia that goes into relative internal rotation because we get external rotation and abduction here at the distal femur. And then we need internal rotation here at the proximal femur at the hip to be able to actually have the force production so that we don't have to compensate down below. Now, one of the other important things to recognize here is that when we talk about the muscles in the thigh region, we're going to be getting some hamstring activation during these exercises. We want to be feeling that more towards the inner hamstring. We don't want the inner hamstring actually pulling the knees together. Instead, we need to keep those knees out just enough to get distal femoral external rotation. Then we need to make sure that that tibia is rotating into internal rotation to get those inner hamstrings to engage, but without bringing the whole knee in. So when we're doing the next exercise that we're going to see here in a second, just make sure that you're not allowing those knees to come together. Instead, you're going to be keeping them slightly apart, but not by squeezing your butt and bring them out, but just by maintaining position wide enough so that they're not coming together. Okay, so this first exercise we're going to do is going to be a heel raise. We've got a couple of specific cues here. So we're going to put this band just above the knee, so it's at the distal femur. We're going to just push out just slightly into abduction. Now what we're not doing is we're not turning out the legs and squeezing the butt. We're keeping the butt relaxed here, but we're just going out against the band until those knees are in line with the hips. Now from here, we're going to get pressure in the toe box of the foot so that we have pressure on the base of the fifth and first metatarsal. Okay, then we're going to lift up the heels, and I want you to really think about lifting the heels, not necessarily pushing the toes, but you're going to lift the heels up, which is going to help engage your calves a little bit. And from this position, you're going to make sure you have contact in both aspects of the toe box. What you should see here at the end is that the inner part of the heel swivels up towards that inner part of the knee. So if you can visualize that, I want you to think about that inner aspect of the heel swiveling up, especially as you get to this top position. Now, if you're holding onto a wall like I am, you can move yourself back a little bit to really load over those feet and get your center of gravity just a little bit further back. It's going to help you access a little bit of that hip internal rotation versus if you're way, way forward in space like this. So then from that position, you're going to lower nice and slow, but making sure that the foot just doesn't dump out into that flattened position. Instead, you're going to make sure that you allow that inner aspect of that heel to come down and out a little bit more slowly as you come down. So inhale as you come down. And then exhale, pulling that inner heel up and in. And you're really thinking about lifting the inner heel more than pushing through the toes. Inhale down, exhale up. And throughout, you're keeping just a little bit of that pushing out force against the band. and using your hands to control the center of gravity. Inhale down, exhale up. You should really feel the inner aspect of the calf starting to work. Now, additionally, what you might want to do is bend your knees a little bit. We're just going to take the gastroc muscle out of this, okay? And it's going to make the soleus muscle, which is the deeper calf, work a little bit more. Okay, so same cues apply. Inner heels coming up and in. Hold a second or two. Use your hands for center of gravity. Inhale down. Exhale up. What we're really trying to do is take some of that pressure off of that peroneus longus muscle. It shouldn't be the main decelerator of that plantar flexion moment as we're coming down into dorsiflexion. This is a nice controlled exercise, but this is going to set the stage for future progressions such as running, plyometric drills, or anything that requires jumping and landing.
All right, so now for exercise 2, we have this prone hamstring curl, and we have a band just above the knee and just above the ankle. You also see that the toes are pointing in as well. So we're going to roll the tape and talk through what's going on here. So the band that's at the knee, just above the joint, is actually on the distal femur. And so we're pushing out into abduction to keep those knees separated a little bit, which is going to allow for relative tibial internal rotation at the proximal tibia. Now we're pointing those toes towards each other so that we're in a little bit more inversion. And if you look at the heel here, you'll see that the inner heel is pulled up just a little bit relative to that outer heel. So you can see that angle of that heel is a little bit with that foot in supination. Now, essentially, after we pull out with the band at the knee there, and then we bend the knees up, we're straightening one leg out. That's going to provide us a stable foundation to then pull against. Then we're going to lower down and inhale, and exhale as we pull back up against that stable foundation. So really here, you're kind of working the quad on the right side, and you're working the hamstring on the left side. We've got the legs both doing the same thing with the band just above the knee, and we also have both toes pointing slightly in with the heels getting pulled up and in, so both feet are a little bit more towards inversion and supination. Now you're going to inhale as you come down, and you're going to exhale as you pull up against the resistance. So knees out, legs up, straighten one out. Then you're going to inhale down and exhale as you pull up. Toes stay pointing towards each other, slight resistance in the band at the knees to maintain that distal femoral abduction. And what you should be feeling is that you get a decent amount of activation, that inner aspect of the knee, lower leg, and upper leg. So inner hamstring, as well as the inner aspect of those lower leg muscles.
Okay guys, so that is it for this one. If you fit that presentation, you have peroneal tendonitis, give these exercises a try. You can do them once or twice a day as long as you don't increase discomfort significantly. I think if you do that for a couple weeks, what you're going to find is you're in a better position to then load and not have quite so much irritation in through those tendons. So thanks a lot, and until next time, peace.